Welcome, everyone. Thank you for joining us this evening. For those of you who do not know me, my name is Gisella Carrick. I'm the first and only senior practitioner. This doesn't mean I'm old, everyone. It just means I've been doing this for a long time. And I would like to introduce a very special guest tonight, a friend of mine, Dr. William Spurlock. I had the privilege of meeting Dr. Spurlock in Dallas, where I was being treated for multiple chemical sensitivities. He is one of the most experienced physicians in integrated medicine and chronic fatigue and chronic or fibromyalgia. Welcome, Dr. Spurlock.
Thank you, Gisella. Well, welcome everyone to Dallas. That's where I'm sitting right now. I've been doing this work for about 8 to 9 years, focusing on a lot on chronic fatigue syndrome and fibromyalgia. And one of the things I want to say right off the bat, and I think it's going to be a little controversial, so hear me out before you get upset. There isn't a disease of chronic fatigue syndrome or fibromyalgia. Those are syndromes of underlying diseases. And the trick of the doctor is to figure out which underlying disorders that patient has and treat them appropriately so that you can correct the chronic fatigue and you can correct the muscle pain. Now, there are definitions of these disorders and there are treatments for these disorders by the traditional medical field. But the truth is most of those medicines really just mask the symptoms. Now, I'm going to start off by talking about hormones because hormones are a very big part of these disorders. Hormones are sort of chemical messengers that are sent out from the cells or glands in the body that affect other cells or glands in other parts of the body. The receptor sites in the affected cells are designed to interact specifically with the corresponding hormone. Some of you may know about endometriosis. Well, that actually is a poisoning of the receptor sites of estrogen and progesterone by inorganic phosphate pesticides. And so there's nothing wrong with that person's estrogen and progesterone. The problem is the receptor site's messed up. So there's many complex things that can be discussed here, but it depends on the individual patient. Now, this is a complex process that scientists call the hypothalamus pituitary adrenal axis, abbreviated HPA. And this is a mechanism which the hormone signals are sent to turn the system on and off, and the biofeedback program, which, essentially is what turns the system off if you have enough of a hormone. So essentially the hypothalamus, which is found in the deep part of the brain, signals the pituitary gland, which is just below the brain, and it's sort of a hormone thermostat. It sort of detects if you have enough hormones to produce stimulating hormones that affect different glands and cells in the body. And the adrenal glands are found just above the kidneys, are one of the most prolific producers of hormones in the body, and are strongly influenced by the pituitary stimulating hormones. There are other glands in the body also affected, such as the thyroid, testicles, ovaries, etc. Once these hormones have interacted with the receptor sites in the affected tissue, the hormones are produced to do their work. When sufficient supplies of these hormones are present in the bloodstream, the pituitary and the hypothalamus turn off the need for stimulating hormones in what we call the biofeedback loop. Therefore, the body is able to increase and decrease hormones as is necessary for proper functioning. In the syndromes of chronic fatigue syndrome, fibromyalgia, and stress syndromes, the hormone system may be deficient or damaged by any number of mechanisms. These include damage to any of the glands mentioned above, such as the hypothalamus, pituitary gland, adrenal glands, thyroid, testicles, ovaries, pineal gland. Damage can be due to toxins, such as heavy metals, chemical irritants. It may be due to infections or excessive stress over long periods of time. One of the groups of people that I see the most frequently are women I call superwomen. They push and push and push and push, and they're a mother, and they work full-time, and they're president of the PTA, and they do everything for everybody, and eventually they just burn out. Even though that stress may feel like it's good, stress eventually does get to you. Thyroid disorders are very common and occur sometimes right after the delivery of a baby, so I'll see a lot of patients right after they've had a baby. And the nutrient deficiency can also cause a lack of ability to produce hormones, like B12. B12 is really wonderful for you. It's probably present in almost all of our enzyme processes. If it's deficient, you cannot make your hormones correctly. Gastric bypass surgery can certainly lead to nutritional deficiencies. We're going to discuss various hormones that routinely are problematic in chronic fatigue syndrome and fibromyalgia. There are many hormones in the body that really don't affect these two disorders and therefore will not be discussed. The hormones we're going to discuss tonight are thyroid hormones, pregnenolone, cortisol, DHEA, progesterone, aldosterone, testosterone, the estrogens, growth hormone, and melatonin. We're going to discuss their function and the symptoms of their deficiency and their treatment. Treatment is fairly simple. You just simply replace what's missing. Okay, we're going to start with thyroid and adrenal hormones. Okay, hang on here. The production of thyroid hormones is, again, we mentioned that the pituitary gland will put out TSH, thyroid-stimulating hormone. That makes the thyroid gland in your neck put out T4, which is what, if many of you know anything about thyroid, it's a synthroid product that doctors give patients. T4 doesn't do anything. It converts in the blood and in the tissue to usually T3, which is the active hormone. But unfortunately, occasionally it will also produce reverse T3. And that is there for a reason. It's supposed to be there for what we call starvation. But we're seeing it in epidemic proportions at this time, and it's sort of frightening what it's doing. But it's actually, most doctors do not draw that test, so they're not aware that that is a particular problem the patient's having. I have a hormone cascade that we talk about, and it starts with cholesterol. Cholesterol is the building block of all your hormones, so it's a good guy. It's not a bad guy. You need it. Elevated cholesterol is actually a symptom of an underlying disorder. It in itself is not a problem. Cholesterol, through the help of thyroid, turns into pregnenolone, which is a major memory hormone that we all need, but it does a lot of other things. And pregnenolone, through an enzymatic process, will convert to three things: cortisol, which has to do with stress management, pain, achiness, and stiffness, immune system, and it also has to do with blood sugar stabilization. It goes to DHEA, and DHEA stands for dihydroepiandrosterone. Probably don't want to remember that, but it is a hormone that has to do with memory also, but it also has to do with the immune system, and it makes our sex hormones. And for you ladies, it makes progesterone. And then progesterone further breaks down into aldosterone, which is a hormone that has to do with your blood pressure when you change positions. And then the DHEA goes into testosterone and the estradiol, and estradiol goes into the other estrogens, including estriol and estrone. Okay. Now, DHEA, we're going to talk about it first. DHEA is one of the most abundant hormones in the body. It's also a precursor hormone. We've talked about that a little bit. And this is a substance from which other hormones are produced. Now, the DHEA is mainly secreted by the adrenal glands, but it's also produced by the skin and the brain. It's an essential component in many of the body's physiological and metabolic functions, including building the immune system, reversing the effects of stress, regulating hormone balance, and helping maintain levels of well-being. It's important as an anabolic or protein-building state, and it increases the breakdown of fat. It also can increase energy, strength, and libido. The studies link it to reduced cardiovascular risk and restored sexual vitality. It's most known for its ability to produce testosterone, estrogens, and promote memory. The simple treatment for DHEA deficiency is an over-the-counter supplement of DHEA. Now, let me make this clear. There are a lot of over-the-counter supplements that are out there. I don't think a patient should be willy-nilly going out there and just picking up stuff because Dr. Anna says to go take it. I think you each need to find a physician or a healthcare practitioner that is well-versed in supplementation to help you find not only the correct products to take, but the correct company to take it from, because some stuff is good and some stuff is not good. So, I know all of you may not have that, but it's really good to have someone that can help guide you in picking out the correct supplements. But this does not require a prescription. And I really believe almost anyone over 40 usually needs this one. I usually start at a low dose, around 25 milligrams. Pregnenolone is the next hormone. This is one you probably never have heard of, and it sounds a little bit like pregnant. It has nothing to do with that, but that's the way to remember it. It's a major precursor hormone. It helps you make all those other ones we talked about in the adrenal cascade a few minutes ago. It's made in the brain, and it functions as a memory enhancer. It's a factor in cellular repair. It participates in the brain and the nervous tissue. It protects against neuronal injury. It facilitates cerebral function. It is made directly from cholesterol with the aid of thyroid hormone. The treatment of pregnenolone deficiency is an over-the-counter supplement also, pregnenolone. My usual dose is about 100 milligrams. Cortisol. Now, this is a major hormone that has a lot to do with people, and most of you have been hearing about it on television and that it causes people to gain weight. That is only true if it's excessive, and that is rare for me to find that in most patients. Most of my patients, it's very low. So it does not make people gain weight. There's a few side effects where people sort of swell when they take cortisol, but that's not very often, maybe 5%. Cortisol has 4 major functions and probably many more. It is noted for stress management, and the way you notice is the person doesn't handle stress well. They overreact to stress. It's an anti-inflammatory hormone, which helps with that pain, aches, and stiffness. If you're missing cortisol, you're going to be miserable. It helps with memory, and it helps with blood sugar stabilization. And here's some other symptoms that go along with low cortisol: hypoglycemia, recurrent infections, sugar cravings, anxiety with stress, nausea, brown spots on the skin, pain, brain fog, shakiness, low blood pressure, food sensitivities, tired during the day, inflammatory diseases, increased pigmentation of the skin, achiness, moodiness, dizziness on standing, poor stress functioning, salt cravings, allergies to foods, medicine, and eczema and psoriasis. The treatment for low cortisol is with hydrocortisone, either at the regular or compounding pharmacies. These are all prescription. There are some over-the-counter supplements that are also helpful and contain some animal glandulars like sheep, cows, pigs. I use those, but I'm not a big fan of those because I like to use human things, and I like to put human things back into humans. So if I have a choice, I'd usually use the human identical products. But there are some over-the-counter products that are available for cortisol. I actually like one product from another company called Cortitrol that uses 4 herbs to sort of stabilize a person's cortisol levels. Aldosterone is the next hormone. It's a hormone responsible for blood pressure stability with changes in position. It also maintains the proper fluid balance in the body. And the major symptoms of low aldosterone are as follows: dizziness, lightheadedness, fatigue when changing positions, like going from sitting to standing. It also is responsible for increased urination, including nocturia, which means going to urinate during the sleeping hours multiple times. It also is responsible for low blood pressure. The treatment for aldosterone deficiency may include Florinef, a prescription medication, also called fludrocortisone. But increasing your salt intake may help, and also if you replace progesterone in women, it may help you make your aldosterone again. So sometimes aldosterone deficiency is literally a progesterone deficiency. Melatonin is next, and this is something that probably most people are aware of and have taken. And melatonin does not help you go to sleep. It helps you get better sleep. And this is produced by the pineal gland in the brain. It's a neurotransmitter hormone that regulates our circadian rhythm, your pattern of sleep. Research shows that the cells of the body rejuvenate and repair during the deeper stages of sleep, and the deeper stages of phase 4 sleep help produce the natural killer cells, which are important for a strong immune system, and growth hormone production. Deep sleep also helps energize the body and improve mood. Melatonin has been a powerful antioxidant, which also helps with disease prevention. Melatonin deficiency is linked to poor sleep, jet lag, irritability, hypersensitivity, and premature aging. Studies also link it to inhibiting breast cancer cell proliferation when you use it properly. Treatment of melatonin deficiency is simply by replacing it with over-the-counter melatonin. We usually start at about 3 milligrams. You can go all the way up to 21. Some people need more, some people need less, but we usually start at 3. The thyroid hormone. Now, this is, to me, one of the most important ones and probably one of the most commonly low hormones that I see in my patients. It has several major jobs. It's produced by the thyroid gland, and this metabolic hormone regulates temperature, metabolism, and brain function. It contributes to energy levels and the body's ability to maintain a constant temperature. It increases fat breakdown, improves head hair growth, reduces cholesterol levels and body weight. It is a hormone that's probably the safest and most beneficial cholesterol-reducing agent, yet it is infrequently used for this purpose, but I do it all the time. I get a lot of my patients off their statin drugs because when we treat them with thyroid, their cholesterol usually comes back into normal range. It is also vital in the prevention of cognitive impairment, or brain fog, as we might call it. It has 3 major purposes. It's the metabolism hormone, which we've just basically talked about, the detoxification hormone. This is really critical. It helps remove toxins from your body. Each cell secretes toxins into the interstitial fluid. Without thyroid hormone, you cannot pull that into the bloodstream and eliminate it, so you have to have thyroid hormone. And it's also called the master hormone because it's pretty clear-cut that it helps you make all your other ones. When it's missing, everything else goes low. The symptoms of low thyroid include these: weight gain, cold intolerance, heavy menstrual periods, morning fatigue, depression, low body temperature, dry skin, cold hands and feet, sleepy during the day, headaches, high cholesterol, thin hair, generalized fatigue, poor motivation, water retention, swollen eyelids, constipation, muscle cramps, slow growing and brittle nails, enlargement of the neck, especially at the base, swollen calves and feet. In children, they may be seen as bedwetting. That could be the issue. Carpal tunnel syndrome, diffuse hair loss, diminished sweating, coarse, thick, dry skin, difficulty losing weight, slow heartbeats, hoarse voice in the morning, muscle achiness and soreness, decreased hearing, and brain fog. The treatment of thyroid hormone deficiency includes the replacement of thyroid hormones, usually from either the regular or the compounded pharmacy, but may also include animal glandulars and iodine replacement supplements. The animal glandulars you may have heard of. Armour Thyroid is the most commonly used product, and there's several others that are in that area. Again, I prefer to use the human identical, but I do use the animal glandulars if I have to. Human growth hormone. This is an important one, except it's a very expensive one. It's not easy to replace because it's so expensive, but it's really critical to how the body functions. This is produced by the pituitary gland and converted by the liver into a protein called somatomedin C, or IGF-1, insulin-like growth factor 1. That's the test I order to detect if you have a normal value. It is this IGF-1 that's responsible for most of the growth hormone function of the body. Growth hormone contributes to ongoing tissue repair, cell rejuvenation, bone and muscle strength, brain function, enzyme production, integrity of the hair, the nails, the skin, and fat breakdown. The signs of growth hormone deficiency are significantly correlated to the signs of aging. Body composition shifts from lean muscle mass and high energy levels to increased fat, increased body weight, and low energy levels. Decreased bone mineralization. Your vitality will ebb and decrease. Cardiovascular disease and mortality increase are also accompanied by low growth hormone. Concurrent with physiological effects, decreased human growth hormone has also psychosocial effects that include impaired physical performance, poor sleep, and decreased social interaction. Growth hormone supplementation can result in significant improvements in energy, sense of well-being, along with decreased muscle pain, body fat, and signs of aging such as wrinkles. Treatment for hormone deficiency includes mostly injectable growth hormone. There are a few what we call secretagogues that are from rice that do help if your growth hormone is not too low. And there's the product out there that I can't remember which company, I think it's Biotics, is called Gaminol Forte, and it works really well. But if you're really super deficient, that's not going to help. Now, the problem with growth hormone is that it might be covered by the insurance, but it's pretty hard to get it. It costs anywhere from $250 to $400 a month to do that treatment. So most people can't afford it, but it is sometimes the one thing that makes people feel wonderful. Testosterone is produced by the adrenal glands and the testes and the ovaries. It's a hormone vital to both sexes. It contributes to muscle mass, strength, endurance, decreased fat, increased exercise tolerance, enhancement of well-being and sex drive. In males, the testosterone protects against cardiovascular disease, high blood pressure, and arthritis. It leads to improved lean muscle mass, increased bone density, decreased cholesterol, improved skin tone, improved healing capacity, and increased libido and sexual performance, obviously. It prolongs the quality of life by decreasing age-related diseases, as estrogen does in females. Testosterone is extremely important in females also for body fat reduction, sense of well-being, libido, endurance, and energy. So it's an ideal option for both men and women. Testosterone helps significantly with insulin activation and therefore prevention or treatment of diabetes. The symptoms that we see with low testosterone include poor strength, poor muscle tone, varicose veins, poor regular drive, your mojo to make you want to get up and go to work and do stuff in the morning, low libido, excessive fat, hemorrhoids, diabetes, difficulty achieving orgasm, cellulite, easy bruising, and Alzheimer's, and brain fog. The treatment is with usually prescription testosterone for men probably over 40. For men younger than 40, I might use HCG or human chorionic gonadotropin because when you use testosterone in men, it could shrink their testicles and make them sterile, and we don't want to do that in young men. So if you use HCG, it maintains the testicular production of sperm, and therefore that man is still fertile and can have children. And the precursor DHEA also helps with testosterone production. Now, you ladies, I want y'all's level to be between 30 and 60, but I want a man between 700 and 1100. So we don't use a lot of testosterone real early in women because I got to get your estrogen and progesterone stable before I can add that in. If you give testosterone to a woman too early, she'll develop acne and hair growth on her face and maybe even some rage, and that is not something women approve of, and they're not happy with me if I do that to them. So I'm careful with testosterone in women. They do not make a testosterone for women at the regular drugstore, so I have to usually get it from the compounded drugstore, and that works pretty well. Progesterone. This is considered a female hormone, although it's found in both sexes. The root components of the word pro means for, and gesterone means gestation or pregnancy. So that's the importance of this hormone. High levels of progesterone during pregnancy is what prevents miscarriage. So a woman that's having a lot of miscarriages, a good possibility she has low progesterone. It's produced in 4 areas of the body: the ovaries, the corpus luteum, the ruptured follicle where the egg comes from, and the adrenal glands, and in pregnant women, the placenta. Progesterone is also used to treat PMS. It protects against uterine and breast cancers, osteoporosis, fibrocystic disease, ovarian cyst. The symptoms of low progesterone include irritability before the menses, endometriosis, generalized anxiety, swollen breast and belly prior to menses, violent cramps with the menses, poor sleep, breast cyst, fibroids of the uterus, general irritability, and nerve irritability. I really do believe that this is very important for the neurological system, both in men and women, and some of the more advanced ERs are now using progesterone in their IVs when someone comes to the ER with a head trauma because it's so protective of the neurological tissue. But for you ladies, your major benefit for this is probably two things: sleep. We guys don't get to take this one, but it really helps women sleep significantly better. And it also is really helpful for anxiety, and it gives people, they have much less anxiety if they have appropriate progesterone levels. Now, the treatment for progesterone deficiency is usually prescription progesterone. Do not use the progestins. There's a product called Provera and Depo-Provera. That is not a natural progesterone, and it is not good for you. And this is old medicine they used to use, but we don't use that. Now, if any of you have had some questions about taking some of the female hormones because you've heard of the cancer scares, that is for the bad estrogens and progesterones that we do not suggest you use. So don't let this fool you. We actually think that these, taken properly and the correct hormones, actually have the opposite effect. They help prevent cancer. So you take the good stuff. Now, you can get these from either the regular drugstore or you can get them from the compounding pharmacy. Now, there's over-the-counter progesterones, but these are very low dose and are not extremely helpful just because they're so low. Okay, estrogens. These are the primary female hormones, although it's seen in men a little bit. It's secreted by the ovaries, and it's also present in men. Like I said a little bit, actually both men and women can convert their testosterone and their estrogen back and forth. And we'll see that sometimes. You might see a man that's sort of big and he might have what we call man boobs. And if you check him, he probably has high estrogen levels. You'll have women that have, probably really muscular. They're really sort of a little stocky. They have hair growth in their face and they have acne and they probably have too high of a testosterone level. In women, estrogen protects against heart disease and stroke and osteoporosis, Alzheimer's disease, memories, disorders, vaginal atrophy, and urinary incontinence. It also prevents symptoms of menopause, including the hot flashes, irritability, mood swings, temperature regulation. It improves balance by improving the visual sensory system within the central nervous system. Estrogen deficiency also results in sagging breast tissue and skin, increased facial wrinkles, fatigue, depression, mood swings, decreased libido. Estrogen is instrumental in orchestrating the menstrual cycle and works in harmony with progesterone, both of which are essential to normal, healthy female function. Signs of low estrogen include low libido, Alzheimer's, vaginal atrophy, mood swings, fatigue, and decreased regular drive, increased hair growth in the wrong places, depression, brain fog, vaginal bleeding, heart disease, vaginal infections, coarse skin, rapid aging, hot flashes, and decreased vaginal secretions. Now, one of the things I think that estrogen is really the best for is for energy. My mother made the mistake of getting off of her estrogen products several years ago, and she was just having to sit down every 15 minutes. And then she could sit there for 5 minutes, and she'd feel better, and she'd get up and she'd work for another 15 minutes. But what she had done, she's gotten off her estrogen. She didn't tell me. I discovered this, and I went and got her some immediately and put it back on her, and within the 24 hours, she was completely back to normal. So it also has to do with energy for women, as testosterone has to do with energy for men. Now, the bad estrogens were the horse estrogens, and Premarin was the product that most of us know about. Premarin, pregnant mare urine, and that's where it's taken from. And it's used to replace human estrogen. But these are for horses. It's not for humans. And they're too strong for women. And they have increased incidence of cancer and heart disease in women. And that's all the studies you heard were about that product alone. Now, they were used for years, and it did help some women, but it always put women at risk. But even so, this is the worst product on the market. It only increased the cancer rate by 0.41%. So even then, it wasn't, that scary. It was an increase, but not much. So the correct form is to use pure estradiol, estriol, and estrone. These can be from either the regular pharmacy or the compounding pharmacy, although the estradiol is the only one you can get from the regular pharmacy. The other two you have to go to the compounding pharmacy to get. They can be used as patches, gels, creams, sprays, pellets, and troches. I don't recommend the pellets. Oral pills for estrogen replacement are not recommended due to the first-pass problem with the liver. That's where the estrogen can be changed into something else, and you don't really want that to happen, and except at the very end. You want it to go through the skin first, or through the sublingual tissue in the mouth. Indole-3 carbinol in your diet is a supplement that helps your liver process estrogens properly. And that will help, your body process estrogen properly so you don't get into trouble. This can be found in your food, and it's found in the cruciferous vegetables, broccoli, cauliflower, cabbage, kale, and Brussels sprouts. Now, Genova Labs actually has a test that can tell us if you have problems with your breakdown products of your estrogens, and that is something that puts women at risk. But that's a very simple test to do, and you can either eat those vegetables or there's a pill of indole-3 carbinol that helps your liver process estrogen properly. Now, in chronic fatigue fibromyalgia, let's talk about that for a little bit. We believe these are actually just aspects of the same set of disorders. They're both energy crisis problems. It's pretty easy to see chronic fatigue syndrome as an energy crisis because you're just tired all the time. But how is fibromyalgia, a muscle pain disorder, an energy problem? Well, all of y'all think about writer's cramp. When you get writer's cramp, your fingers draw up and they hurt. And if you straighten them out, they really hurt. Well, that's when the muscles don't get enough energy. They contract or they get smaller. And if you move against them, it hurts. So the lack of energy getting to the muscle tissue is what causes that fibromyalgia pain. Now, a lot of people come into my office with pain. It's not all muscle pain. It's, they have all kinds of issues for pain. And so we have to look at it. It could be just a cortisol deficiency. You just ache all over if you have that. But if you're not getting enough energy, then you have to do that. Now, many things that we use are for energy. And we talk about the mitochondria, and that's a really important area of the body, too. Mitochondria are these little powerhouses in each cell that take certain ingredients and make our energy molecule we call ATP, or adenosine triphosphate. If the mitochondria are damaged for any reason, like Epstein-Barr virus particularly damages mitochondria, which is the monovirus, or it may be lack of nutrients, or it may be lack of hormones. You don't know. But for you ladies, y'all have iron deficiency problems sometimes. Well, the energy molecule has to have iron to be produced. So you don't want to be low on iron. So you want those energy molecules produced. Now, we think of this as a cycle of dysfunction, and it may include a genetic predisposition. Some things do run in families, and they're more prone to develop certain things. Then there may be a triggering event, a physiologic stress, like I said earlier, like having a baby, or being exposed to maybe some pretty nasty chemicals. Or it, may be a major life event that was really negative in your family. But a lot of times it's an exposure. And we'll get to different aspects of that in a minute. And that will trigger both sleep disorders and pituitary and neurochemical dysfunction. And then that pituitary and neurochemical dysfunction will lead to hormone deficiencies. And then that will also cause stomach problems and GI disorders, and that will cause nutritional deficiencies. And all of those things lead to the mitochondrial dysfunction, where they're not producing the energy molecules. Then we can have some immune dysfunction thrown in there, infections. So my three worst groups of patients I see that have the big infection issue is going to be dentists and their dental assistants, because they get exposed all the time, pediatric nurses, and usually women who work in the pediatric area, which would be elementary school teachers, daycare workers, or maybe even pediatric nurses, because those people are exposed to these infections all the time. And some of them never leave your body. And then that can cause a primary infection or a reactivation of an old latent infection. That sometimes leads to neurotoxins, which we see in Lyme sometimes. And then they start to create clotting disorders, which causes the blood to be thick, and it doesn't carry the energy molecules very well, and it can lead to other unpleasant health problems. So that is the whole concept of that these underlying disorders cause this. Now, we use a 6-component approach to evaluating the patient. One, we stabilize the patient, get them where they're feeling better and that they have enough stuff on board to be able to function. Component 2 is the mitochondrial enhancement. There's a lot of supplements that are for that, and there's also just the hormone replacement, especially thyroid. We balance the hormones as a component number 3. Component number 4, we treat the infectious components. Number 5, we address the unique problems like the clotting disorders or the neurotoxins. And number 6 is our maintenance phase that we have with our patients. So how do we stabilize the patient? You deal immediately with the following problems: disordered sleep and pain management. That helps them be more functional significantly right away. Mitochondrial enhancement. There are several supplements that might use that. NT factor is something that a lot of companies make in different names. It's a phosphoglycolipid that helps rebuild the mitochondrial function. Ribose is the sugar backbone for the energy molecule, ATP. Coenzyme Q10 is a supplement that helps with that process of forming those energy molecules. Iron. And then malic acid helps actually move the energy molecules to the muscles, and that's found in the skin of apples, but there also are malic acid or malate supplements on the market that we might use. We balance the hormones, and these are usually include the thyroid, the cortisol, the aldosterone, the pregnenolone, the DHEA, the growth hormone. I need to rephrase growth hormone. That is what that does in young people. It helps them grow. But in our age range, it's better called the youth hormone, so it's probably mislabeled. And then we replace the sex hormones, estrogen, progesterone, testosterone, as necessary. The infectious, what we use there is we have to identify the infection. So what I commonly see in my patients in the bacterial area is Lyme, Mycoplasma pneumoniae, Chlamydiophila pneumoniae, Ehrlichia, which is a co-infection of Lyme sometimes. I might see viruses such as Epstein-Barr virus, cytomegalovirus, herpes virus number 6, herpes simplex 1 and 2, Coxsackie A or B virus, and parvovirus. I may see funguses like Candida, albicans, or similar ones. And for parasites, we may see things there too, such as Babesia, which is seen along with Lyme sometimes. We may also see unique problems, and these might be the clotting disorders. They may be heavy metal toxins. I do a lot of removal of arsenic, lead, and mercury from my patients here. And then we may see some cardiac problems that are very unique in my patients. We may see postural hypertension tachycardia syndrome called POTS, and I see a lot of mitral valve prolapse in some of my patients, and those that need to be dealt with so we can do the treatment we need to do. Maintenance. Once the patient has recovered, then the treatment needs to be maintained in order to keep the patient stable and functional. And then we do periodic visits and lab work to keep the levels of the hormones and nutrients in the proper range. Infections need to be controlled, much like HIV and herpes are controlled in the patients that have those problems. A lot of doctors do not know about these other infections, and nor do they think they're important, but they can be very, very significant in my patients. And the younger the patient and the sicker they are, the more likely they're going to be with infections. Those of you on the northeast coast are more at risk for the Lyme disease because it's just more prevalent there. Chronic fatigue syndrome and fibromyalgia, it's not uncommon for patients to spend over $100,000 trying to obtain adequate treatment before reaching our center. So chronic fatigue syndrome and fibromyalgia have been poorly treated with standard medical care, but they are very treatable. And so I don't want people to get discouraged with those disorders. So I'm going to stop it right here. I mean, I could talk for 3 or 4 hours, but I'm going to stop it right here and let you all start asking questions about specifics. But it's basically, remember, a conglomeration of underlying disorders that lead to these two disorders. And then, of course, Gisella is going to talk a little bit later about the quantum treatments that they do that also help in other ways.
Okay. Dr. Spurlock, first of all, Cheyenne, I've got the question. Are you still on, Cheyenne? Hello, Cheyenne?
Yes.
Okay.
I'm here.
I've got the question section that were sent in through the web, and I'm going to go ahead and ask these questions to Dr. Spurlock, and then if the person has anything else to say, how do I get them to unmute?
If they'll press *2,
okay.
We'll unmute them one at a time.
Okay. So first I'm going to start with a question from Diana. And her question is, Dr. Spurlock, is there a connection between CFS and people with mercury and amalgam fillings?
Well, yes. But remember, chronic fatigue and fibromyalgia are a conglomeration of things. So I do see people with mercury, and I do see people with, the problems with the silver mercury fillings in their teeth. We definitely test them for that, and we treat them for that. It's part of the problem of select patients, and that sometimes makes a huge difference in how they feel.
Okay. And one of the things I want to add with quantum techniques is one of the things that we deal with is a lot of our clients, and I'm sure you see this too, Dr. Spurlock, are real sensitive. So they initially can't do a whole bunch of treatment. So one of the things we begin to doing is just balancing the body so that they can and accept treatments like the treatments you're describing. I know I was one of those people. So when I came to QT and did some of these treatments with helping with just the balancing of the body, the emotions, and other things, I was able to do a lot of the treatments you're talking about more successfully.
Yeah, and both of us have worked with Dr. Ray, and sauna is another way of dealing with heavy metals or other toxins in your body. And again, sometimes that may be too intense for a patient also, and they may have to back off of that. But that's a simple way of doing that, and it's effective. I use a lot of DMSA and EDTA in my office, but that's what we mostly use.
Perfect. And then for those people that have not done quantum techniques before, are not familiar with the testing we do, and I work with other doctors. People have their own physicians, or Dr. Spurlock or others. I could test, or we can test for them, like what would be beneficial, because a lot of times it's hard for people who have these sensitivities to try something and end up in a reaction state. So doing some of the testing that we do, we can actually give a person an insight and say, okay, yes, this is beneficial to you. Okay, let's go on to the next question. There is a question from Stephanie, and her question is from Portland, and her question is, could soil-based probiotics be helpful for this condition?
Which based?
Soil-based probiotics, could they be helpful for this condition?
Well, we definitely believe that leaky gut syndrome is a part of this disorder, and it's seen in a lot of patients, and so we really believe in strongly repairing the gut. And what we really suggest is, ridding the intestinal tract of candida if possible. Thyroid actually helps with absorption greatly, and then we definitely think that probiotics are critical for not only absorption of your nutrients, but also part of your immune system. So, yes, I use probiotics in all my patients, and soil-based is the best.
Well, great. Okay, the next question is from Lori in Port Washington, and, this is for me. Can QT increase mitochondrial production, normalize T-cell count? Lori, what we do is we help, again, with balancing emotional aspects and other things in a person's field, and it does automatically just begin to balance things out in the body. And then, again, one of the things I found very helpful once I did this was going back and doing some of the things that Dr. Spurlock spoke about, and they do become very helpful. It's like we can work together. It's a really nice balance. That's what I found was the most useful thing for my healing. I'm going to take some questions from people who are, on the web. And what I'd like to do is ask anybody, okay, we've got somebody from Santa Rosa, California that is raising their hand.
Hello.
Hi there.
Can you hear me?
I can. Thank you. You have a question for Dr. Spurlock?
Yes. I was interested in what he had said a little bit ago about, people trying for years to get help and spending hundreds of thousands of dollars and not giving up hope. But what if you've already been through that and spent the thousands of dollars and have not gotten proper treatment or proper diagnosis and now are out of funds? Now it's like even if you can find the right people, you can't afford to go to them because it seems like no one who knows how to treat these things takes insurance or works low fee. Does he have any suggestions for people who need to do things really on a very tight budget?
Yes, get Dr. Jacob Teitelbaum's book called From Fatigue to Fantastic. And that book is a very, very good book that is very specific and has lots of information of things you can do for yourself. He also has a list of doctors in there that, are in the different areas of the country that can help you, maybe. And I've had poor patients come to me, and we're just very, very careful with what we order for them. But when my office, we don't take insurance for the office, but all the prescriptions are covered by insurance and all the lab work is covered by insurance. So it's just office visits. So we keep that office visit very short. As my shortest visit is 30 minutes, but we keep it short and we get very detailed and we do very specific things. And the patient just, they've already been through a lot, so they know a lot to do already. But we just sort of help them work through that. And the lab work is really your major expense. And and we let you use your insurance company for that. I do, anyway. And so that can be handled that way. But there are, there's different things that can be done. If you have a doctor that's not reasonable and won't work with you, if your money, find another doctor. Because it can be still done for people that have limited resources.
Great. Thank you. Does anybody else have a question? If so, raise your hand. And
I have a question from a client wanting to know if using pregnenolone is beneficial to your Nenolone.
Well, yeah, pregnenolone is one of the major memory hormones, but it also is one of the hormones that makes all your other hormones. So, yes, it's very beneficial, and it needs to be, done properly, and we monitor it with blood work just to make sure that you're on enough. But, yes, I think it's very beneficial. The main thing that patients notice from it is that the brain fog that they feel and their short-term memory problems get much better when they've been on that for about a month.
We've got a couple others, but they're about a transcript. Will we be providing this as a transcript in the future? We'll get back with those clients directly. Just want to let you know that there were several people requesting a transcript of this event.
I can provide a slide series here of what I talked about tonight if people want that.
Okay.
Thank you.
Thank you. Yeah, and those people that would like that, just contact me at Quantum Techniques, Gisella at quantumtechniques.com, and I will go ahead and provide that, get that from Dr. Spurlock. We do have another caller that has a question, and this caller is in first three digits are 851. Go ahead with your question. Hi.
Hi, how are you tonight?
Good, thank you. Go ahead with your question.
Yes, please. Thank you so much. I've had Epstein-Barr virus for 13 years. I'm now 57, and things are not improving. I've been to doctors for years and years, and allergic to a lot of things. And I'm just wondering where Dr. Spurlock is located, and is the treatment completely natural because I'm only into holistic and integrative medicine?
Well, there are many, many, many things that can be done for any of these infections. And some of them you would consider natural. I mean, I also use the prescription antivirals if the patient can tolerate it, and those seem to work well. But there's certain IVs that we also use. Where are you located?
I live in Reno, Nevada, near Lake Tahoe.
Okay, well, there's actually a really wonderful doctor in your area. Her name is Alina Garcia, and she is well-versed in these things. And she's out of Vegas area, but she is, if you can find her, she is really helpful. Now, I'm in Dallas. And I'd be glad to see anybody, but the point is that there is somebody there in Nevada that's pretty good. And I've known her for a long time. She's an excellent doctor. And she knows all the same protocols that I use. But yes, we can use any number of things. I use some Ayurvedic medicine. We use glycerinate. We use a multitude of things for the patients to see if we can get them better. I use a variety of IVs that are unique: hydrogen peroxide, colloidal silver, the combination of vitamin C and glycerinate and thymus extract. So, yes, there's many options besides the traditional prescription medications.
Okay, thank you so much. I am actually allergic to colloidal silver.
Well, we would use that then.
Yeah, right. And what was after you said Ayurvedic, you said something that I'd never heard of before. Starts with a G? I can't remember what you just said a word, and I didn't know what that was. So this Alina Garcia, is she in Las Vegas?
Yes.
Okay.
A-L-I-N-A.
A-L-I-N-A. Thank you so very much. I will look her up. I appreciate your help.
Sure.
Okay, and then again, remember, you can, for those people who know how to do the testing on their own, you can use the testing we teach to check these products like the colloidal silver that the lady was just saying she's reactive to. Any other questions?
This is the moderator again. We have a flood of questions coming in on the webcast. Do patients generally need to be on hormones for the rest of their lives?
Well, it certainly depends on their age, but unfortunately the answer for that is probably yes. Now, not all of them. It's real common for me to give testosterone to women initially, but then later we take them off of it. And my own personal case, I went up to 75 micrograms on thyroid medication, and over the years I've been able to reduce it down to 20. So the issue is as you get better, you'll need less. It's rare that you will be able to get off of them, and especially you menopausal women, you're not going to ever get your estrogen and progesterone back. So if you want to stay healthy and alive and keep your brain working, those are something you'll have to take forever. But most of the people, they do have to stay on them because they have a deficiency. We're not removing the problem that caused the deficiency. We're just treating the deficiency. So usually, yes, you have to stay on the hormones.
Okay. The next question is, and just let me know how many of these we have time for. When someone's tried many, many practitioners and found that they have multiple infections, such as fungal, viral, bacteria, Lyme, or metal toxicity, what order should that be addressed?
Okay, well, let me make this really clear. I am a very big believer that you should not initially attack the infections with a patient that has not been treated before because, and this is complicated, but you sort of go to war with the infection when you start treating it. And if your body is not pumped up and ready to go for that war, you're not going to do very well. And a lot of patients will crash and burn. A lot of doctors focus on Lyme, and they hit Lyme full force in the very beginning, and the patient just crashes. So you need to make sure you get your hormones and your nutrients up first. Then once you get sort of stable on that, then you begin to treat the infections. Now, what do I think are the worst infections? Well, probably, if it's true Lyme, then you really have some real issues with that one. You got to really work on that one pretty hard. The viruses are probably next, and they can be pretty nasty. That CMV virus or cytomegalovirus goes all over your whole body and causes all kinds of problems. But people will do really, really well sometimes when you treat the viruses. The bacteria, the mycoplasma, and the chlamydia are also very important, and they feel significantly better when you treat that. The funguses, I almost always treat that almost in the beginning because Candida is so common. And so we treat that pretty easily, and most people do pretty well. Now, we haven't brought this up, but Herxheimer reaction, also called healing crisis, also called die-off, can make you feel really bad whenever you're treating the infections. Now, we prepare patients for that. We have medications to help with that. But it is actually a good sign. It just feels terrible. And it just means that these bugs are dying off, and you're going to do better. Now, the viruses, especially in the herpes family, of which there are 6, and that includes mono, CMV, chickenpox shingles, the herpes virus number 6, those never leave your body, and you can put them in prison, but you cannot kill them. And so you need to take something to keep them held down all the time once you've got them under control. So that is another aspect of treatment that is probably lifelong.
Interesting.
Okay.
I have Penny. She's asking, do you use 7-keto-DHEA at all?
Yes, I do, because there are certain women that when I give them DHEA, they have too much testosterone production, and it messes them up, and they can't tolerate it, and so I put them on 7-keto-DHEA. Now, the benefit of that product is that it helps you with the memory, but it doesn't make the sex hormones, and so that's why we would use 7-keto-DHEA, and yes, I use it.
Fantastic. Ava would like to know, could you talk a little bit about thyroid and progesterone, that relationship between thyroid and progesterone?
Well, I mean, there's not a direct relationship exactly. Thyroid is critical for the production of pregnenolone, and then pregnenolone makes progesterone. Now, here's the deal that I think, and this is just my own opinion. I don't know that any other doctor would back me up on this one. But the reason that thyroid may be the master hormone is that it's the detoxification hormone, and there may be a toxin or a heavy metal or something that's blocking the movement of pregnenolone to progesterone. And so when you bring thyroid on board, it may actually be removing the toxin so that that process can go from point A to point B, and that may be how it really works. And again, this is just my opinion, but I do believe that thyroid is critical for helping us be able to go from point A to point B with our other hormones. Now, but it's not a direct correlation as far as we know between those two.
Cheyenne, I've got some questions that I can see now, so I'm going to ask these of him. We've got a few more minutes, Dr. Spurlock. Is that okay? Are you okay with a few more questions? Okay. The next question is coming from Gracie, and she asks, what do you recommend for Candida? The diet is difficult to do long-term, and it also seems not to really take care of it, and some kind of antifungals are needed.
Well, I use everything I can get my hands on according to the patient and what they can handle and what they can't handle. I really don't like the diet either because I think it's ineffective, it takes too long, and it's miserable. So I don't usually do the Candida diet very often, but it is something the patient can do. My drug of choice, of course, is probably diflucan, but I've used nystatin. The difference with nystatin is that it never gets in the bloodstream, and therefore it has less chance to cause, side effects. But there are people that have side effects of nystatin too. I use Spurlock, I use Lamisil, I use Nizoral, I use all of them, depending on the patient. Most of them respond pretty quickly the first time around, but you have to treat these infections for long periods of time. Most doctors will give you a few days' worth. For Candida in the gut, I'll usually use it for 2 months if you can tolerate it. Now, there are some other treatments that are also out there. They're a little bit different, but, we could talk about that at some point. But the issues are that you have to treat them for long periods of time. Now, here's the deal with Candida. It can always come back. Candida is everywhere. It's not really a pathogen. It's everywhere. And it's just not supposed to set up housekeeping inside your body, and it does sometimes. Now, that's where the probiotics come in. If you can keep your body really well tuned up, take your probiotics, daily, you will pretty much keep the intestinal lining healthy, and the Candida will have no place to land and start growing. Now, here's a problem that most of you may not know. Most of the meat in our marketplace has antibiotics in it, and that's been going on since 1985. And so it not only kills the bad bacteria, it kills the good bacteria. so it'll kill your probiotics. So if you're not replacing your probiotics frequently and you're eating traditional meat from the traditional grocery stores, you're going to get into some trouble and you're going to have candida overgrowth. So just remember that. Antibiotics and candida go right hand in hand sometimes. And then once they've gotten a well-established footprint into your intestinal tract, it may take a while to get it all out. So we do a pretty long treatment, and we base it upon what the patient can tolerate.
Okay. Chris has a question from Flemington. The supplements that you were referring to, are they from organic or inorganic sources?
Supplements? Well, that varies. And let's just talk about those words for a minute. Everybody gets all these words mixed up. Natural, organic, bioidentical. And for the hormones, I prefer, to use what I call bioidentical. Now, for you ladies, I can get estrogen from yams, and I can get progesterone from yams. But unfortunately, the thyroid hormone, the only natural place is from other animals, and that's not necessarily something I want to use, but that is natural, but it's not human. So it's a synthetic product that's 100% bioidentical. Now, for the supplements, most everything that we use is pretty much from plant-based, but some of it is from synthetics. But we really are careful with the companies we use, and we want them to be made so that it is 100% bioidentical. Now, like if any of you take fish oil, which is very good for you to take, but if you take it, the issue is you need to make sure, it comes from ocean fish. Well, it can be loaded with mercury. So you've got to make sure the company is, checking and removing the heavy metals through some kind of process. So if you get a supplement, call the company and ask them questions and ask them how they handle those things and where the sourcing is from so that you can get that information. Now, remember, arsenic is natural, but it's not good for you. So you have to be careful with all these things. The terms are sort of weird. I prefer the term bioidentical, something that our body makes or utilizes exactly like what you're taking in the product that you're buying.
And again, something that you do and then we do with our testing is it sounds like you also very careful on because people, because I know you've worked at the environmental health clinic, that there are clients that even though you have, something is natural or bioidentical, they can have reactions to. So
yeah, and one thing that we talk about with that is that, the product itself may be fine, but it may be the filler of the pill that's the problem. It may be the capsule that's the problem. It may be the dye that's in the capsule or tablet that's the problem. And so sometimes we have to make sure that we're dealing with the right issues. And the point behind it is that people will complain they can't take a product when actually the problem is that they can't take that product and they could maybe take another one. But that's getting pretty deep into the care of patients and their individual problems. We hope that most of you don't have that, but if you do, there are ways of figuring those things out. And I have pharmacies I work with that will work with you with fillers and certain types of capsules so they can meet your needs.
Okay, great. A question from Diana, and she asks if you are sensitive to DMSA and DMPS, could the heavy metals be removed safely with homeopathic remedies?
Well, remember, I still believe that thyroid is the number one thing to help you with detoxification. Remember that you don't want to be constipated also because stuff reabsorbs. There's another product called Cholestid or cholestyramine that a lot of the Lyme doctors use that helps remove toxins from the body, and that doesn't get in your bloodstream. I said sauna is a really helpful way of doing it. And anything that's homeopathic that just increases your detoxification mechanisms, which your liver is one of your major ones, so is your skin, so is your liver, then that will help you with detoxing. And then drinking plenty of water, good clean water, doesn't hurt flush stuff out of your body. So, yes, there's many ways of treating heavy metal toxins and other toxins without using DMSA and DMPS or EDTA.
Okay. Great. Dr. Spurlock, it's 9 right now, so I'm not sure if you want to continue a little bit or if you're
I'm open.
done.
I'm open for whatever y'all want to do.
Okay. Why don't we take a couple more questions and then we'll wrap it up with you. Okay. I've got a question from Ed, and his question is, what is your recommended progesterone replacement for postmenopausal women?
Progesterone?
Mm-hmm.
Well, of course, I use many different things. I prefer the compounding pharmacies because I think it's a little cleaner and purer and you get bioidentical. But there is one bioidentical product that's available in the regular pharmacy. It's called Prometrium. Now, it may say 100 milligrams. It may only be 75 when you really take it. But it's in peanut oil. If you have a peanut or nut allergy, you can't take that product. But I use Prometrium for those patients who need to save every penny they can and to use their insurance. So we use that in them. And I use progesterone in women. There is no absolute dose. It's very dependent upon the woman. I would say the average dose is around 200, but I never start at full dose. I always work my way up because these patients are very sensitive. And if you start at full dose, it makes them sick. So you have to work your way up. I might start at 100 and work my way up to 200. You can give them as much as 800, but you have to be really careful with progesterone because if you get too much, it makes a woman either very depressed, and that can be weepy depressed or irritable depressed. So you have to just sort of watch them as you raise those levels up. And then you have to watch them if they're still having menstrual cycles. It will cut the menstrual cycle down to almost nothing, or maybe it will be nothing. But you have to watch what you're doing, and you have to explain a lot to the patients as you go through it. But I would say the average dose is between 100 and 200 milligrams.
Okay. Well, one of the things that, and again, I'm not sure if you're familiar with, and I know you're not completely familiar with what we do, but one of the things I've noticed with our clients, some of the clients I've worked with, when they've had these type of hormone therapies or other type of medication that they're on, as they do the treatments, the body does begin to balance. So there is a time when the doses will go down. I have seen that with our clients.
Like with me. Yeah, I went down on thyroid from 75 to 20. So, yes, you will be able to go down because your body will kick back in and you won't need as much. And I actually tried to get off my thyroid. It didn't work, but I tried. So, I mean, I always let my patients try things and see what happens, and if it doesn't work, let them go back on it. But, yeah, definitely, as you get better, you need less.
Yeah, and like I said, with quantum techniques, one of the things that we do is the stuff that we address, what I've noticed is that people do, like you said, they do get better, they get less. And it really is, for us, what I've seen, it's almost like healing on steroids. So everything that you're doing, it gives everybody like a little boost that, it then allows these things to work quicker. And it does work sometimes better than what even, the doctors intended. So that's the real exciting thing about this.
Yeah, and my experience with Dr. Ray's patients in the Environmental Health Center is that sometimes with those people that are extremely sensitive, I use little tiny doses, and that is very helpful to them. It allows them to take it, and they respond very well to tiny doses.
And that's all they need, yeah, exactly.
Yeah, tiny doses. And, I even use, my thyroid hormone in just water, and they take drops of that, and it's just water and just thyroid, so there's nothing else mixed in it. And they do quite well with that.
Yeah, a lot of times the energy of something is sufficient enough to help someone. I've seen that happen a lot. Great. Okay, so let's take one more question. There's a question from Joan, and she was late to this, but she would like to know if taking testosterone would help sex drive, and would it also help with warm flashes, hot flashes?
Not so much with the hot flashes, but it would definitely help with sex drive. Now, remember what I said earlier in the lecture, and Joan, you may have missed it, but you have to balance that with your estrogen and progesterone. If you don't do that, you can get into, excessive testosterone levels for women. And so we like to do a balance of that, but yes, it definitely does help with that. Now, estrogen itself helps with sex drive also, but you do not want to take testosterone in the absence of estrogen. Now, I'm not saying you have to take estrogen, you just have to have adequate supplies of your own. And so, yes, but I do think that it helps balance everything out. And the problem with maybe hot flashes with women is that sometimes doctors underdose them for the amount of estrogen they need. Every one of you is individual and has an individual lab value that the doctor needs to achieve the goal of helping you. And they need to be, brave enough to step into that territory. I've given you sometimes more than what's recommended on the box, because that is not always what's going to work. And I talk about that like a shoe size. If you have an individual shoe size, you have individual lab values. So, yes, I use testosterone frequently in women, but sometimes when I replace estrogen and the DHEA, then they make their own testosterone themselves naturally. Now, the husbands that really are, being ugly to their wives because of the low sex drive, I have to have a little talk with them, and I say, this takes time to get this all corrected, and give me time, I will get them there. And one poor lady, her husband was really ugly to me, and we finally got her sex drive back, but then she said, Dr. Spurlock, now my breast is so tender I can't stand for anybody to touch me. Well, I have to do some extra work to fix that. But these are the issues that we deal with. You have to be doing it correctly. Do not do this willy-nilly, because you can really mess yourself up.
Got it. I know I said last call, but let's take one more on the phone. This caller's been up for a bit. It's caller number 515270. Please hit *2 to unmute yourself, and go ahead.
Hello. Yes, I'm listening intently, and I have been doing QT for the last year, at least twice a month. And when I started QT, I had been on estrogen. I had just finished using that, and I was still on progesterone. And I'm 61, and energetically, I never test that I need estrogen or progesterone or any of them. And so when I'm listening to him saying that you're probably on them for the rest of your life, I'm wondering, could I be enjoying a better level of hormone levels? Would that make a difference in my life, or am I really where I'm supposed to be?
There really are some genetic people that they just do well, and they are able to maintain. The next issue is that it is possible that your shoe size is lower than other people's, and that's perfectly normal for you, and you do well at that level. Because my reference ranges for the lab work are not written in stone. The issue is, are you having symptoms of the low estrogen, low progesterone, low testosterone? Because the issues, and of course Gisella can speak to the energetics of the quantum techniques, but the issue here is that you don't need to do something that makes you worse. And so I have some women that I give progesterone to. I know they need it, and it causes them hip pain, and I take them off of it, and the hip pain goes away, and I put them back on the progesterone, and they have hip pain again. So I have to do it from another direction. So sometimes, even though people need it, I can't give it to them because they have an adverse reaction. So there are many, many things that go through that. Now, if my father is an example, I don't know why he can maintain his testosterone level. He's 80 and it's running 700. I've never seen that in anybody else in my life but my father. I'm not as fortunate as my father is, and I have to take testosterone. But, we each have our own uniqueness, and if it's working for you and you're not having problems, then you might not need those hormones.
Well, I guess I'm wondering, would I enjoy a better level of life if I was on something? But if you don't test for it energetically and you're living by that, then do you just say, okay, I shouldn't do it?
Well, no. Have you tested this, done some blood work, or however Dr. Spurlock would recommend testing this, the hormones, whether through saliva or something? Have you done any kind of other testing other than just the energy testing?
Absolutely not, and I think that I sort of drew a line in the sand and said I was done with living my life with all of that because I used to do all that, and
right.
It didn't work well for me. And I also used to be on 210 milligrams of Armour, and before that I was on the synthetics, but they didn't work well. I never hormonally was very well. I was always estrogen dominant and low progesterone, so it's kind of a surprise that all of that has smoothed out, and now I'm only on 90 milligrams of Armour. So, I've had a major balance, so to speak.
Well, it sounds like you're doing better, and that's what we look at energetically is when we do these treatments, is that the person does improve with, everything. The medications come down, even the supplementation, everything they're doing starts to balance out. Now, one of the things I have done myself as a client and even a practitioner, I always suggest people, and this is why I have such great guests like Dr. Spurlock on the phone, I suggest to them that they continue to go to their doctor, or, someone they trust. I wouldn't go to a regular doctor. I've been down that road also. And no offense, Dr. Spurlock, I don't mean.
I understand completely, believe me.
Yeah, because they don't understand the stuff that someone like Dr. Spurlock would understand. So using somebody like him, I have another source, Dr. McCarter, who I trust completely. I would go to someone like them and then, have them do some testing. And then from there, you make your decisions whether it's something that would be beneficial to you to do the supplementation, again, under the care, like with somebody like Dr. Spurlock, not somebody who doesn't know, the ins and outs of these things, people's sensitivities and all that. And then continue doing your energy treatments because they do help. It's like healing on steroids. Everything that I'd done in the past, supplementations, IVs, everything, they maintained me, sustained me. And once I found this work, what it did was it actually allowed the things like what Dr. Spurlock is talking about to help, to actually make a difference, to heal, not just maintain or sustain me. I wasn't just surviving. I was actually healing. So I think using both and still doing testing, again, with the appropriate person is very important.
So I want to make one more comment here about this, about the questions she brought up, is that, when you said you were able to reduce your Armour thyroid, and that's really good, and the point is that it actually is, the thyroid helps you make your other hormones, so it could be actually helping you make them, and so that could be fixing your problem. The other issue is that you asked about, could you be feeling better if you took a little bit? Well, the answer to that is, yes or no. And the point is, I'm a real big believer in proof in the pudding, is that sometimes you just try things. As long as it's not going to hurt you, you try something and see what the response is. If it's a good response, you repeat that behavior. If it's a bad response, you don't repeat that behavior. But sometimes you will not know until you try it. And so, remember, I believe in very small dosage increment increases with patients so they can tolerate things well. But sometimes, a lady, I'll say that her estrogen level should be at least 80 on the blood test. But I will tell her clearly, you may feel much better at 180. So my 80 is the bottom of what I will allow. So there's definitely a lot of wiggle room in there that you can play with it a little bit and see how you do. And if it makes you feel better, then that may be a better dose for you. And so that's something you'll have to figure out with your healthcare provider to see what works best for you. With thyroid, it's a real interesting corollary to that. I have patients that they need more in the winter and less in the summer. Mm-hmm. So there's some different variations that we see all the time with different patients.
Dr. Spurlock, no, go ahead. I'm sorry.
I was going to ask also in energetic testing then, I've been taught, and it has worked well for me, is to ask, it's in my highest good to, and then you would add progesterone. And if you energetically get a no, do you still go with that then, or should I do as he's saying, give it a little try with something?
Well, and here's the one thing that I found with testing for myself, and this is a little trick I do, is once I clear, any kind of wrong beliefs or anything, I also just ask to clear my own belief system out of the way, because, as you know, one of the hardest things to do is to test yourself, because if you have fear of something or a belief, or you've had some trauma around something, like you just mentioned that you have a trauma around going down that road and how bad you felt. So that
right.
can, again, impede your testing. You can make you, get inaccurate testing. Okay. So I think that that's something that you may want to look into a little bit.
Yeah. Okay. Well, I'll ask Beth a little bit more about that. So great.
Okay.
Thank you.
Sure. And Dr. Spurlock, what I was going to ask you was, do you do phone consults where people can actually send you, their test? You can do blood work or something, even though they're out of state, or some type of testing that they can still work with you directly?
Well, and let me explain how that works. We do phone consults a lot here because I have patients all over the country, but we do want to see you at least one time so I can take a physical look at you and make sure that I'm not missing things. I can diagnose a lot by looking at the person. And we like to see them physically. Plus, also, that's legal. It's sort of not really legal to just only treat patients over the telephone.
Gotcha.
So maybe one day when we get real Skype and stuff really in place, and people aren't bothered by the computers, that we could do that a little bit better, and they could show me things, and I could see things by looking at them. But we like to see them once, and then after that, we do the rest of them by phone.
Okay, perfect. If you would like, I'd give your information out, the clinic, your email address, or your phone number where you can be reached. I think the people online would appreciate that. And then I'm going to let you go.
Okay. Do you want me to tell you that information?
Yes, please. You go ahead.
Okay. Well, of course, I think you listed our website on the page that they can look up everything if they wanted to. And the email address is info at renewedvitalitymd.com, MD like doctor, MD. And, our telephone number here is 214-389-1234. And again, 214-389-1234. And our receptionist is Karen, and she is very pleasant and very easy to deal with. And we'll be glad to hear from any of you. And like I said, you can contact us through email. You can go to the website. And we do have our own newsletters. And again, I'm not doing quantum techniques here, but I work with people like Gisella to help people every way I can, help them get, what I call the true team approach to fixing their problems.
And that's exactly what I suggested. Again, this was my answer to healing, was not just doing one specific thing. I think everybody working together, if you get a good team, a doctor, a practitioner, whether if you have some energy medicine type thing you're doing, you find something that works and then stick with it. I think that's the best approach. So thank you, Dr. Spurlock. I thank you for your time.
Sure.
And everything, and I'm going to head and cut you loose because I am going to take a few minutes and do talk to somebody that volunteered for a treatment, but I don't want to hold you up, so you're welcome to hang up.
Okay.
All right, good night.
Thank you very much. Bye-bye.
Thanks again. Okay, callers, we have a volunteer this evening. We don't have a lot of time, so I'm going to do a very quick treatment on Ed. Ed, if you can unmute yourself, *2. Are you still there?
Can you hear me?
Yeah, I can hear you now.
Okay.
Okay, guys, so you heard a lot of stuff about the physical aspect of treatments with, what Dr. Spurlock does, what regular MDs do. And again, one of the things that I find is to work in conjunction with, somebody like that, a practitioner, a medical practitioner, and then doing quantum techniques. Again, this was my answer to healing. So Ed is new to quantum techniques. He's never done a treatment, or he's done somewhat of a treatment, but he's never actually worked with one of our practitioners. So Ed, I'm going to have you tell a little bit about yourself, and let's talk about the chronic fatigue issue because that's what we've discussed this evening.
Yes, well, I've had chronic fatigue for 25 years, and it's I learned for me what worked to bring my energy back was water fasting. I got that from this guy named Dr. Esser in a place in Florida. And you go on water fast for anywhere from 5 days to 25 days. And that would bring my energy back, but then after a while, after a few years, I'd have to do another one. And so I was pretty much able to conduct a normal life doing that. I tried a lot of other things, all, candida related, all kinds of stuff before that. And the last fast I did was 12 days in October, and my energy didn't come back.
Okay,
and,
so right now your energy is still pretty weak. Is that what you're saying?
Yeah, it's pretty weak, and I have multiple chemical sensitivity, which is my hugest issue right now.
Okay, and so you don't have a big option as far as taking a lot of supplements. Are you in the place where you're reacting to a lot of the stuff that you try to do?
Yeah, I'm reacting to, but not. It's the thing for me mostly is fragrance chemicals. That's what I react to, and cleaning products and other stuff. So.
Okay. All right. So I'm going to go ahead and start and give you just a demonstration on what we do, and also for clients that have never experienced quantum techniques to give you a demonstration of this. Again, this is done over the phone, and what we do is get a voice lock on the person. We have them answer a series of questions, and then we give them a code at the end. And this code basically has the information of what we've done during the treatment, and they repeat it, and it will continue to work on the issues we found during the treatment. If anything non-physical comes up, and as you and I discussed previously, I'll try to just kind of skip over that because, again, we have such a live or large audience. I'm sure you don't want a lot of your personal stuff out there. So repeat after me, Ed. Say, I want to be healthy.
I want to be healthy.
Okay, so you're reversed. And for those of you who don't know what that means, it means that the energy pattern in your body is going the opposite direction it should. You should be flowing clockwise, and it's going the opposite direction. It means you're not in a place of healing. Your cells are not in a place where they can heal. So, Ed, I want you to take the fingertips of whatever hand you have free, and I want you to bunch them together like you're picking something up with your fingertips, and then I want you to place them approximately 2 inches above your belly button spot.
Okay.
Tell me. Okay. Now repeat again. I want to be healthy.
I want to be healthy.
Okay, so now you're unreversed, okay? So if anyone that's listening, if you're ever reversed or feel like you're, again, with symptoms, I would feel, for me, I feel like I was blacking out or passing out or something. One of the things that when I learned to do some of the testing or just some of this work, I could hold that spot, and that would help me significantly in just recovering myself. Okay, so hold that spot and say I'm 100% clear of blocks to accurate testing.
Repeat that, sorry?
Yeah, repeat that. I'm 100% clear of blocks to accurate testing.
I'm 100% clear of blocked accurate testing.
Deception. Interference. Obstruction. Wrong beliefs. Or negative attachments. Okay, and for me, I'm a Christian, and Ed, is it okay for me to use God or Christ in an affirmation to help clear this field?
Yes.
Okay, so this is how I clear this to begin with to get more accurate testing. By the power of God's truth, light, and love, I command all the darkness, deception, interference, obstruction, wrong beliefs, negative attachments, anything in Ed's field or my field, not serving God or Ed's highest good, we command it to leave now and never return. We then fill these spaces with all of his truth, light, and love. Okay, then I'm going to check to see if Ed's brain spinal cord connection is out, and it is out, so I'm going to reset that. Okay, Ed has an EMF field. Okay, is this field physical? No. So there's something non-physical in his field that's already blocking this. Okay, so I'm going to clear for him this chronic fatigue syndrome as a curtain, and we're going to also clear MCS as a curtain, okay, just so that the body can see this a little bit more clear. Okay, so in this field, would it be in your best interest for us to clear it as a sedation factor? No, mucosal lining. Okay, so the mucosal lining in the body is what's coming up first. So we're going to clear functional, healthy healthy antimucosal lining factors in the body and skin as it pertains to this chronic fatigue syndrome. We're going to clear that as a curtain. Okay. So in this field, if I ask, are there any frequencies involved? And what that means is I'm looking for any type of medications that Ed may have taken that are still blocking any receptor sites, including the hormone receptors. And since Dr. Spurlock spoke a lot about hormones tonight, we're just going to clear hormones as a curtain to begin with. And if I ask in Ed's field, is there a specific hormone his body wants to clear? Okay, there is. So pregnenolone is definitely one of them that's coming up. And we're going to go ahead and clear that as a curtain right now. Is there some other hormone that his body wants to clear specifically? Okay, I'm not getting that. So if I ask in the field how many frequencies are involved in this, or still blocking this field, again, medication frequencies, I get more than, okay, I get almost 40 frequencies. Ed, say that, say more than 40?
More than 40?
No, actually I get 36. Okay, so there's 36 things that are still blocking. And Ed, you don't have to repeat or remember every single medication you took in your lifetime, but if something that, like for me, I know that there were certain medications like digoxin or imipramine or Klonopin that I knew were really a factor in making, kind of making me, just pushing me over the edge. Is there something like that? And this can be in your lifetime that you can remember.
I think something called diflucan, which was for amoebas.
Okay. Diflucan is an antifungal.
Oh, maybe.
Okay.
Well, whatever the.
Okay, but is there any? And did you take a lot of antibiotics?
I don't like them because I.
And again, I know I'm not saying you like them. I'm just asking you in your lifetime, did you take antibiotics, or were there any medications that you took that were that you felt were very toxic to you?
Well, I think I did take antibiotics and I did take anti-amoeba medication.
Okay.
So those are things that I can think of that were heavy-duty medications.
Okay, let's ask your body, is it in your best interest for us to know more? Okay, I'm not getting we need to know more. So just for time purposes, I'm going to include just the field antibiotics and then the anti-amoeba medications that you took. Okay, and then we're going to go ahead and clear these frequencies again as a curtain. Okay, your body wants to clear these right off the get-go from the stomach, the small intestine, the large intestine, okay, your liver, your spleen, okay, pancreas, okay, gallbladder field, and then also your adrenals and your thyroid. Okay, the hypothalamus needs to be clear of these frequencies also. Okay, and then we're going to clear the hormones in a group, okay, of these frequencies, the neurotransmitters in the brain and the gut. Does your body want to clear any neurotransmitter specifically? Okay, it does. Your histamine, okay, human growth hormone, okay, thyroid, okay, is a specific thyroid hormone. Okay, let's just clear it from that specific field. Okay, is there some other place in your body that these frequencies need to be cleared from? Okay, I'm not getting there is right now. Okay, so if I ask in the field, okay, how many factors are involved in this field? Okay, say more than 300. Ed, repeat that. Say
more than 300.
Okay. Okay, I'm getting about 280. Okay, of the 280, how many of these frequencies are viral for you? Okay, I get 130 approximately are viral, bacterial. Okay, say more than 2.
More than 2.
Okay, so do you suffer from depression at all?
A bit.
Okay, there's a bacteria called Clostridia, okay, and I'm seeing that in your gut right off the get-go, so we're going to clear that bacteria as a curtain. Is there something else in this field that needs to be cleared for him? Okay, and I have a list of bacteria. We're just going to clear some of these. Salmonella, E. coli, Pseudomonas, okay, are any of the ones that Dr. Spurlock mentioned tonight beneficial? Yeah. Okay, so if I ask in that field, okay, here, okay, so what is it for him? Pneumonia. Okay, let's go ahead and clear that one that he mentioned specifically from your field. Okay, if I ask, is there something else that we need to clear, some other bacteria as a curtain? No. Okay, so the remaining factors, if I ask, are any of these mycoplasmas? Okay, say more than 20.
More than 20.
Okay, so you've got approximately 20, so those need to be cleared. Let's pull that in as a factor field. Okay, fungal. Okay, we've got about another 100 fungal fields. Okay, the remaining factors, are any of the other factors remaining, are they also pathogens? Okay, parasite. Okay, say more than 1.
More than 1.
Okay, you show one parasite in your field. Okay, is it specific parasite? Okay, do we need to know more? No. Okay, let's just go ahead and clear that. All right, if we ask in the field, any other pathogens involved in this field? No. Okay, if we ask the remaining factors, are any of them physical? No, because the remaining factors are non-physical. If we ask in the field, is there a specific signal or switch in this field that's causing this issue to hang on? Okay, say it's an emotion. Ed, repeat that. Say it's an emotion.
It's emotion.
Okay, say it's a trauma.
It's a trauma.
Okay, so you show a trauma. Is this in your lifetime? It is. For you, if I ask, is it childhood, adolescence? Okay, so it shows up in your adolescent field. Say over the age of 11.
Over
and
the
repeat
age of
that.
11?
12.
Over the age of 12?
Okay, so it's showing up between the ages of 11 and 12 for you. There's a specific trauma that comes up. If I ask, and normally I would just have you repeat it so that people can see. Say this is a physical trauma.
Say this is a physical trauma.
Okay, so it is. It shows up as a physical trauma in your field at age 11, 12. Is it necessary for us to know more to clear it? Okay, I'm not getting that. Okay, if I ask what the switch was in this field, or is there a belief that's blocking this field still? Okay, so there's an issue of safety for you. Okay, emotional and physical safety. Okay, is there some frozen emotion in this field? Okay, there's also frozen emotion that shows up. So these are some of the factors that are coming up. And again, not to pry too much into your personal stuff, but do you feel safe in your life?
Absolutely not.
Okay, so one of the questions that I check, and this is something I do a little further, I work with a hypnotherapist that has taught me a great deal of stuff, and I've begun doing some research on the different levels of the subconscious. So for you, this issue of safety and this trauma, where is it lodged in the subconscious? Is it in the first level, second, or third? Okay, so it's showing up in the second level of your subconscious, so we're going to include that field, the second level of subconscious, and clear it as a curtain. Okay, is there an emotion that's also lodged in that field? So you've got fear, okay, terror, okay, horror, okay, is there some other emotion that's lodged in this field? Okay, not now. Those are the three. All right, if I ask, besides this, is there something else non-physical we need to include in this field? Okay, there's a few more things, but again, it's just going to lead us down a path that may not be okay with you to talk about. So we're just going to include that field. So then what I'm going to ask, do we have 100% of the field needed to clear this issue or begin healing these issues for Ed? Okay, say there's more.
There's more.
Okay, I'm not getting there's any more. Okay, so we're going to go ahead and pull that field in. If I check, that field is reversed. Okay, it is in sympathetic overdrive, and it is a curtain. Okay, so I'm going to go ahead and clear all that. And again, this is all done energetically so that the body begins to, change this at all different levels, including that level of the subconscious where it's lodged. And what I find is a lot of stuff like this, to be more specific of where it sits, as your belief systems begin to change, as you remove these traumas or fears, then these other places, like the things we've worked on today, these hormones will begin to balance themselves out. So, medical doctors do believe that, yes, you have to stay on something forever or for long periods of time. But I've seen a lot of my clients, like the one lady that was talking, that's a client of QT, that she has improved in, the different levels of hormones that she's had to do in the past. Okay, so if I think about this field for Ed, okay, so if I think here first, okay, so your body needs to clear this entire field, so the emotional, the physical, the pathogens, all that's involved from the liver system, okay, spleen, your emotional heart, your stomach, small intestine, large intestines, okay, your kidneys are coming up, adrenals, hypothalamus, pituitary, the blood-brain barrier is involved, okay, proteins, hormones, okay, again, does your body need to be specific on the hormones in order to clear this? No. Say I want to be healthy.
I want to be healthy.
Okay, this field need to be clear from any other cell surface receptor in the body. I'm getting a no. If I ask, does anybody's energy need to be clear from the cell surface receptors in the body? Okay, no. Are there any other curtains in this field? Okay, are there curtains something emotional? Okay, again, is it an emotion, a belief? Okay, so there's some other belief that needs to be cleared. Is it the same issue of safety? No. Okay, so for you, it's here. Okay, Ed, say it's here.
It's here.
Okay, so it's a belief that you are not able to heal. Okay, so you've done, obviously it sounds like you've one of those people like me that had been there, done it, had done a whole bunch of different things, and nothing really worked, correct?
Correct.
Yeah, so that belief is blocking you also, okay? Do you hold that in the first, second, so it's held at all levels of your subconscious, the belief. Okay, and repeat this for me. Say, I can heal from this illness.
I can heal from this illness.
Okay, say, I deserve to heal from this illness.
I deserve to heal from this illness.
No. Okay, so again, you have these things blocking you, so if you don't actually believe that at some level, again, no matter what anyone does, whether it's this work or, someone like Dr. Spurlock or anything else you've done, and I think I read in your bio you did acupuncture, you've been doing that for years and all sorts of different things, and they don't seem to really work, do they?
No.
Okay, so we're going to clear that belief system as a curtain from your field right away. Okay, and again, including these first, second, and third levels of your subconscious. Okay, if I ask, okay, in the field, is there more? No. Okay, so we think about this field. Let's reconnect it to the motor, the amygdala, and these are different engines of the brain that we reconnect and signal to so that, again, you can begin this healing. The pons, medulla, hippocampus, and the cellular memory. Okay, so the limbic brain needs to be reconnected. Cranial nerve 10, which is the vagus nerve to all its branches, needs to be reconnected. Okay, trauma. Okay, the lymph and C7. Okay, do we need to reconnect the field to anywhere else in the body? Okay, so cortical contacts, association, he wants to be healthy. Prefrontal. Okay, sensory, he wants to be healthy. Okay, the rest is fine. Okay, if I ask, bregma, so these are sutures that need to be reset in your body. Okay, this field is reconnected to the glabella. Okay, we have bregma, lambdoidal, suture, coronal, sphenoid, sagittal. This field need to be reconnected to anything else in the body. Okay, specific organs and glands. Again, the thyroid is reconnected to that, the adrenals, your kidneys, your liver. Okay, in the liver, the specific functions, so detox functions are not connected in this field. All your liver functions are out. So let's go ahead and clear that first. Say phase 1 for me.
Phase 1.
Okay, phase 2.
Phase 2.
Okay, so your phase 2 is out. Let's go ahead and reset cell memory in that field and reconnect this field to that phase 2, including the lysine, methionine, glutathione, which helps, amino acids which help with detoxing. Okay, if I ask in the field, does this field need to be reconnected to anything else in the body? Okay, your spirit, let's reconnect it to the spirit. Okay, anything else? Okay, to the first, second, and third levels of the subconscious again. Okay, so if I ask in the field, okay, is there a hidden viral field blocking key informational pathways from healing in your field? Okay, in your brain alone, let's see, amygdala, pons, medulla, cerebellum, and the prefrontal cortex. Say I want to be healthy.
I want to be healthy.
Okay. Okay, you have 49 viruses in that field. Okay, there's about 18 hidden viruses. Okay, bacteria are clear. If I ask in the field, there's still viral fields. Okay, in the thymus, in your thyroid, in your adrenals. Okay, is it in your best interest to continue clearing these viral fields? No. Okay, I'm just going to pull in your liver just because we were clearing that real quick and clear viral fields there. Just in the few fields we found, okay, you show 60, 70, 80, say more than 100.
More than 100.
200.
More than 200.
500.
More than 500.
Okay, you show almost 500 viral fields, so that's quite a bit. All right, if I ask in this field, is there more? Okay. Is it in your best interest for us to clear any more viral fields anywhere else in the body? Okay, you show viral fields still in the cranial nerves, so there's a bunch. And then there's still in the linings of the mucosa, but again, your body's saying that's enough. We can't continue to push you too hard, okay? All right, so if I ask, is there a bacteria or hidden bacterial field blocking key informational pathways? There is. If I ask, is it in your best interest to clear these now? No. Okay. If I ask, is there a fungal field or hidden fungal field blocking key informational pathways? There is. If I ask, is it in your best interest to clear these now? No. Okay. Mycoplasma. Okay. Again, can we do this now? No. Is it in your best interest to clear any other pathogens? Okay, I'm getting a definite no. Again, your body's telling me that's enough. Okay. Is it in your best interest to reset the hormone field? Okay, so I'm going to reset hormones for you. Okay, and then again, what I do is reset them through using that brain engines, but just to give you an example, okay, if I do, okay, the motor, okay, let me rephrase that. Okay, so the cerebellum, which would be the thyroid, that's out, and it's again using the cerebellum, but it's clearing the thyroid, the TSH, the T4, the T3, and the hormones that Dr. Spurlock spoke of. So he wants to be healthy again, so we're going to clear the cerebellum. Okay, hippocampus, that's the liver hormones, cell memory, thymus hormones, medulla, okay, pituitary hormones, amygdala, anterior pituitary hormones, pons, kidney hormones. Say I want to be healthy.
I want to be healthy.
Okay, let's reset melatonin, serotonin, dopamine. Okay, is it in your best interest to reset any other neurotransmitters? Okay, your body wants to reset neurotransmitters in the liver right now, in your hypothalamus, in the thyroid, and in the adrenals. Okay, say I want to be healthy.
I want to be healthy.
Okay, can we do more? Yes. Okay, so let's go. Where does your body want to go next? Kidneys. Okay, he wants to be healthy. Say I want to be healthy.
I want to be healthy.
Okay, is it your best interest for us to reset any protein fields right now? No. Okay, so sensory overload. Okay, let's see what gland is in sensory overload. Say I want to be healthy.
I want to be healthy.
Okay, so for you, if we check, okay, the liver is absolutely in sensory overload with the vagus nerve. Say I want to be healthy.
I want to be healthy.
Okay, is it best interest to continue clearing more? Okay, so here, okay, so the small intestine, okay, again to the vagus nerve, okay, your stomach, again to the vagus nerve, okay, large intestine, okay, again to the vagus nerve. Say I want to be healthy.
I want to be healthy.
Okay, again, I want to be healthy.
I want to be healthy.
Okay, would it be in your best interest to do some gland pairing? No. Okay, so cortical contacts, meaning the left and right brain okay, are not communicating properly, okay, those are out, so we're going to reset that field. You want to be healthy. Okay, the rest is fine. Okay, is it in your best interest for us to do more than this at this time? No. Okay, would it be in your best interest for us to include any immune pathways in this field? Okay, so of the 7 immune pathways, your body wants to do only 1, okay? So I'm going to reset 1. And again, you may feel tired, you may get flu-like symptoms, but that's, again, putting those back online. Of the 7, how many do you have online? Only the 1 I set. So all your 7 immune pathways have shut down. So your immune system is not working. And for those of you who've had tests done on the skin, like to test to see if you respond to, the different bacteria or viral fields that they poke you with, when I was in Texas, I responded to none. Okay, and that's what that means is basically immune system is shut down and it's not noticing anything. All right, so for Ed, immune system is down. The liver functions, the detox functions were down. If I check the rest of his detox organs, okay, that would be like the kidneys, the lymph system, the bladder, large intestine, skin, hands, feet, all of that is shut down also. So I'm just going to clear that field as a curtain and clear it out of sympathetic overdrive. And I'm going to take his whole detox system and just reconnect it to the body's intelligence using the brain engines so that it can begin to release some of these toxins in his body. Okay. As the load comes down, the emotional, physical, or spiritual load, okay, again, all the medications or treatments that everybody else has tried in the past will begin to work better. Okay. If I ask, is there more? Okay, so fluids need to be reset. Your cerebral spinal fluid is out. Stomach fluids, acids, bile, saliva, urine, sweat, tears, blood. Okay, sinus fluid, lymphatic fluids. Okay, so insulin. Let's also pull in bone marrow in that field, and we're going to go ahead and reset cell memory in these fields, clear these as curtains, and out of sympathetic overdrive. Okay, if I ask in the field, is there more? Let's go ahead and clear cellular waste, food sources, water, environmental medication sources. Can his body handle this today? Okay, let's go ahead and clear that all out of the fluids. If I ask in the field, is there more? Okay, Ed, say there's something else physical in this field.
There's something else physical in the field.
Something else non-physical?
Something else non-physical.
Okay, all right, so if I ask, say, if I ask in the field, is it in your best interest to put a filter on this? So I'm going to go ahead only because, again, you're new, okay? I'm going to put a filter on this so that the treatment doesn't hit you and put you in bed. Okay, 50, 60, I'm going to put a 60% filter on this so that it comes at you at 40%. And then, again, it will lower itself as your body can take the remaining of the treatment. Okay, so it'll just automatically do that. Okay, now say I want to be over this.
I want to be over this.
Okay, now let me go ahead and give you a code. You ready to write it down?
Yes.
Okay, it's LF, liver, SH, G50, IF, E, OE, LF, G50, SH, TH, IF, EB, E, OE, MF, SH, TH, G50, LF, E. Okay, did you get LF and then E?
Yeah, I got. Are you saying EH or
SH. SH.
SH, G50, LF, and then E, right?
E, then O, you're right, and then OE.
Okay.
A, C, 9G, UN, SH, UN. Okay, and you're going to do the chakra number 2 twice. You're going to repeat this code 3 times daily. Okay, and I want you to hold your fingertips. You're going to take the index fingers left and right, and you're going to touch behind the ears, the bony part of behind the ears, and you're going to touch that spot at the same time and then let go. This is what you do first before you say your code. Okay, touch there, let go. And then while you say the code, I want you to place your hands over your liver because that's one of the places we need to work. Okay, and then repeat the code 3 times a day. Okay.
Okay.
And that spot behind the ears is your cell memory spot. So that's, again, just reaffirming to your body that we need to reestablish that cell memory in the body, okay? And then if I were to check you now, for those people that know how to test, he wants to be healthy, wants to be sick, you're no longer reversed, okay? I did forget to ask one thing. I'm going to check this real quick. I want you to say, I've lost the treatment.
I've lost the treatment.
Okay. Okay, you've got over 40, 50, 60, 70, 80, 90. You got over 90 lost treatments in your field. Okay, these are all treatments, and now I'm assuming you received a lot of treatments in your lifetime, correct?
You mean QT treatments or?
No, this is, acupuncture.
Oh, yeah.
NAT. Yeah, NAT is coming.
Right.
Yeah. Okay, so all those, in combination of those, you have 90 lost treatments. Okay, so we can get these back for you energetically. So let's go ahead and get those back, pull those back into your field. Okay, say I have a block treatment. Repeat that. Say I have a block treatment.
I have a block treatment.
Okay. Okay, you've got 38, 39. Okay, 39 block treatments. Okay, again, do we need to know more to push these through? So no, we can actually push them through now. Okay, say I have an incomplete treatment.
I have an incomplete treatment.
Yeah, you do. Over 100. Okay, almost 120 incomplete treatments. Okay, so some that just never went through at all. Okay, so let's go ahead and get those back also and push those through for you. Okay, so by asking your field, is there more? No. Okay, and that is it. All right, so if you have any questions, Ed, just go ahead and email me later on, today or tomorrow, and we can talk a little bit and you can tell me how you're doing. Callers, I want to thank you, everybody, for being on the call tonight. And there is one person that has had their hand up forever. So and if that's a QT question, I'd like to answer that. Caller is from San Francisco, 415-410. Unmute yourself by pressing *2. Or if there's any other questions real quick on what I just did or any questions at all, please go ahead and raise your hand. Okay. Again, my name is Gisella Carrick. If you have any questions after this, you can send me an email at gisella@quantumtechniques.com, and I'll be more than happy to answer any questions via email. All right, everybody. Thank you, and good night.